All right, so we are live, and we have with us, of course, this evening, Dr. Margo Roman, Dr. Marlene Siegel, and Dr. Judith Shoemaker. Obviously, this evening, I want to just start by saying, for many of us, our hearts are a little bit heavy. Some of you here tonight don't know this, and you don't know the gentleman we're talking about necessarily, but Dr. Albert Nunez was supposed to be with us this evening on this webinar as one of the panelists, and he unfortunately passed away last week of a heart attack. It was very unexpected, as heart attacks usually are. From what I knew, he was in good health. He was probably early 50s, if that. And so it was just a shock for all of us, especially those. I didn't know him extremely well. I knew him, of course, and respected him, but some of you, I'm sure, knew him much better than I did. But what we want to do tonight is just to remember him. We're going to start the webinar that way, and hopefully just honor him a little bit and his legacy and what he was about. So to start that part of the webinar, what I'd like to do is just read. Actually, I'm going to put a slide up here and start that here, and just read a couple comments people sent to me. I didn't put them all in here. I'm sorry. We don't have time for that, but I do have a few here, and I just want to read those, and then I'm going to let our panelists or others as well, if you would like to. We're going to cut it off at some point if we're going too much, but if you want to say something very briefly, you can, as an attendee, raise your hand. There should be a hand somewhere on your screen, and if you click on that, it will alert me to the fact that you would like to say something. So just keep that in mind. You can also chat something right into the side. Just type it in, and that would be wonderful. So this comes from Dr. Angie Lacoste. She says, I did not know Dr. Nunez, but had the pleasure of meeting him when attending the same training course. He was immensely passionate about the welfare of animals, struck me as a true trailblazer in providing ozone therapy for his animal patients. Truly sad loss, and my deepest and heartfelt condolences to his family, friends, colleagues, and patients. This is Tracy Farley, she says, and Tracy's here with us tonight. I don't know how many of these people are. Dr. Nunez was someone I considered a friend. I told friends about this incredible veterinarian I had met in Florida, who was part mad scientist and part Dr. Doolittle. I wish 100 times over that there were a doctor like him near me, that I could get a critically ill dog to him from Tennessee. The world has lost a dear teacher and veterinarian. It will not be the same without him. He will forever be in my mind and his passion and enthusiasm, with his passion and enthusiasm. Let's see, I can't even actually see the quote here by who it's by, but I am shocked and very, very saddened to hear that Al Nunez passed away. I got to know him a little better at the last HVMA conference when I talked to him for several hours. He demonstrated the use of the sauna wave, and with it, a small group of other veterinarians, we discussed the use and indications of the sauna wave. He was so passionate and knowledgeable about this and related topics, an area I know very little about. I hope that the passionate work for the sauna wave will be carried on by others, and that he and his work will never be forgotten. And then I'm going to see if I have, there was one more that came to me late here, and I was just going to pull it up if I can in my email from Dr. Broadfoot and just read part of it. So this is Dr. Paula Broadfoot. So she says, the world has lost a truly great mind, a visionary with rare passion and compassion. I can scarcely imagine the loss to human and pets alike. His brother called me and begged me to keep Al's dream alive. I don't know how that will happen, but somehow, some way, those of us who held him dear must try to move his vision forward. So at this point, what I'd like to do is just open it up. Margo, I know you were going to say something.
Yeah, no, I again, everyone's words are so true. He was a passionate man who really felt like when he found the HVMA, and I met him about 5 years ago, and I encouraged him to come to the HVMA because he was so dedicated and had this vision of how he could make things better. And when he came to the HVMA, he realized this is like the same thing I'm doing. Everybody here is driven in a way that is trying to find other ways to help their patients. And it's going to be a real loss. I mean, he has young children. He has got a thriving practice, to go that young in your life. And I agree. We need to keep his vision and his passion alive with all the types of things that we do, because it's a hard knock to not a hard knock, but it's hard to stand up and be different in a group of veterinarians that in your area in Orlando, and still have that vision of being forward and wanting the best that you can provide for your patients. And I'm sure everyone that has met him is going to be devastated. So,
yeah. Dr. Shoemaker, are you able to hear us? I'm not getting. I see she's here, but I can't actually hear you, I don't think. So you may need to sign out, sign back in. Oh, there you go. Yes.
There we go. And I'll turn the video on and see if it actually works. I have a little bit of a slow connection.
I see you.
Oh, good. All right.
I hear you. I see you.
I don't know why I'm yellow, but I'm yellow. Anyway, I just wanted to say I wrote you a letter, Jonathan, about this. I feel very strongly that we need to support. I'm going to cry. That we need to support Al's vision. He was a visionary. He absolutely was. I think truly one of the most, as PJ said, one of the most amazing minds ever. He infused us with such incredible knowledge in such a short period of time. He interested us in the most fascinating concepts. He's made me a much better doctor, and he's allowed me to do some incredible, miraculous things with both the SanaWave and with the ideas that he gave to me about treatment. And I think we have to honor his memory by supporting the work. I personally have decided to dedicate a percentage of my charges for use of the SanaWave and direct them to support of the company. And I also feel very strongly that we need to make sure that our clients that understand that we're using this technology, that they be encouraged to contribute as well. So I think that it's something that we can keep alive. I want everybody to know what an amazing man he is. His voice is in my head, thank goodness, because of the fact that we've spoken at least once a week for the last year. And I wish I had all the voicemails. But anyhow, he is truly one of the most remarkable people I've ever met. And I look forward to keeping his vision and passion alive in my practice, and hopefully that we can spread it through professional interaction, and that we can spread it through helping animals with the knowledge that he gave us, and that hopefully we will do him proud. I hope we can all do that.
Great. Yeah, thank you. So it's hard to have a webinar, to be honest, with something like that taking place. But there are many people who came here this evening hoping to learn and hoping to grow in their knowledge and understanding of ozone therapy and maybe some other things as well. So let me just briefly explain how we're going to move forward with this. If you have a question, please chat it into the side and let us know what that question is. The real goal and purpose tonight, we did not have a PowerPoint, okay? We're not going to be doing a regular presentation. In fact, these three ladies and Dr. Nunez did this at the AHVMA conference this last year. And it was awesome. I loved it. I probably liked it more than most people because it's just up my alley. But, I thought it was really, really good information and very profitable. And so the goal is to do that. So if you guys have questions that are off the topic of ozone therapy, don't you dare ask them. No, I'm kidding. I'm kidding. Welcome to ask those as well. The purpose is really just to grow and learn together. And this is just a platform to do that. So I have a few myself. I don't want to hog the time necessarily, but I will definitely get us going, okay? And then as we get going, again, I'll just read the questions off to you, and you can respond as they come in, if that sounds okay.
Okay. Mm-hmm.
All right, so in no particular order, but since on my screen at least, Margo is on the top. I'll start with
me learn ozone therapy, and that is including Judith Shoemaker down here on, I feel like the show where we're in one corner and the other one. But also I had Tina Aiken, who was with me today, and she came out because she's learning more. She's been basically doing rectal ozone and now wants to explore all these other ways of doing ozone, which is really fun. And when you start utilizing those, it really adds to your practice. So I think the unique ones that I'm doing is the intraperitoneal ozone therapy, where we inject ozone gas directly into the abdomen from a standing animal, not putting them under anesthesia. And we're able to, clip the paralumbar area on the right side and put a ozone-resistant catheter and put in ozone gas right directly into the abdomen. And so I've done it from like 24 micrograms per milliliter to 40 micrograms per milliliter into the abdomen. And one dog who was given no time to live, it came to me with a liver cancer and had collapsed and was really weak and couldn't get up. And with regular UVB and ozone, we got him going again. And then he had an abdominal bleed and bled out in the abdomen. He's 14-year-old Shepherd Cross. And he bled out in the abdomen, and he came in with liver functions of 6,000. And we did intraperitoneal ozone, UVBI, and ozone. But the abdominal ozone, I think, really helped him regain it even a higher amount. So that's one of the ways that I'm doing it, which I think is just, I don't do it in every case, but I do it in cases of high liver values and abdominal cancer. So does it want my other ways? I can give you other ways.
Great, that's great. No, that's a good start.
So, also giving it within the bladder. So if you can catheterize the animal and do it for transitional cell carcinoma, or for interstitial cystitis, or for chronic, urinary tract infections, putting a catheter in and flushing the bladder is really a way to reduce the inflammation for interstitial cystitis or any bladder issue. And I'll be very honest, personally, I was feeling like I was getting a bladder infection, and they have commercials all the time how to, do you self-catheterize every day? And I was like, I guess if everybody's doing it on TV, I can do it myself, right? So I took ozone and I put ozonated saline, and immediately the pain went away, like on contact went away, and it was very bizarre. So I thought, wow, that is pretty cool. Maybe I should do it one more time, right? I should probably do it 2 times because one time was good. Maybe 2 times will keep it from having an issue. Did it a second time, and then I couldn't even feel my bladder. And I thought, oh my God, I am going to forget how to urinate. So, but it was fine. But it went away. The instantaneous thing was amazing. So actually 3 days ago, I have only one tooth that has fillings in it. And when I injured my leg, I got a second cavity on that tooth, and I had it filled at a biological dentist, and it was a very small one. I initially wanted to try making I had her make me a silicone mouth brace that goes on where you can put the ozone in one side and take it out the other. And so I decided I never used it. I had her make it for me. I didn't use it. I did some ozone. It helped it, but I decided just to get that little one filled. Well, 3 days ago, it fell out while I was brushing my teeth, and it was so painful. If I put cold water into my mouth, it was like, oh my God, it didn't hurt like that before she put the filling in, but when she had to put the filling in, she made it bigger. So I decided to get that mouth brace out, put it on, and I figured out how to connect it to my ozone, injecting ozone and then getting it out and being able to destruct it and filling it up. I went and drank water, cold water. I didn't feel it. Pain went away like that. So they know that in dental pain, when going to the biological dentist conferences, that they will ozonate a tooth and it stops having the pain and it allows the cavity to fill in. So tomorrow I'm going to get it filled, and I keep saying, well, maybe I should just keep doing this ozone and not have it filled. But the dental in one of the dental discussion, Fadi Sabah, Fadi, he's a Lebanese dentist, and he had pictures of a tooth that was completely had cavitations and a big cavity in it, and he ozonated it, and it reformed the entire tooth. It completely reformed the tooth. And so there's so much information now on the biofilm of the gut and the biofilm of the mouth, and we know that the minerals that are in our saliva will redeposit on our teeth. And so if we have a chance to let that happen, that's pretty exciting to see that happen. So
okay, I have a number of questions already popping up here, Margo, and maybe you see them too, but
I don't. No, I don't. How do we get the messages? It says enable chat.
That's okay. I'll just ask them.
Okay.
What amount of, walk us through just briefly the procedure for IP injections.
So IP injections. What I do is I get this regular, not butterfly, but regular IV catheter, and I realize that most of the IV catheters are ozone resistant. I can't remember the name of the catheter that I use, and I get about a 2-inch catheter. Okay. And I shave the lateral side of the abdomen, and I've got slides on that and how to do it in videos and everything that we can sometime have access to. And I shave the area, prep it like I'm going to do an abdominal tap, and then I take that catheter and I just pop it through, and I have my syringes, and I was using 460cc syringes on this 75-pound dog at the end, and just giving him all this ozone intra-abdominal. And it was working. He lived 2.5 more years, which was amazing. He died at 16 and a half. So, I mean, to have a dog that had liver cancer for that amount of time and that age was amazing. So just popped it in, and then I pushed the gas in as fast as I can, not like, I got to do really slowly. When you do DIV, which is direct IV ozone, which is not encouraged in small animal, and it is used in large animal, but people are using it in small animal. But doing that into the abdomen is not going directly into a blood vessel. It's basically bathing the whole abdominal cavity. So I leave that catheter in. I have my syringes all lined up. I inject it in, okay? And then I just take the syringe down, take the next one, and have those capped off so they're not leaking any ozone out, and inject the next one and next one. But I started initially with this dog at about 120 cc's. 120 cc's. And it was too much for the dog. So I went down to 60, and then I kept building up over a period of about, 3 months to go up to the high level that I was doing.
And what
I initially started at 120, and the dog started getting wobbly. So I backed off to 60. I actually talked to an animal communicator, and she said, start lower than that. Don't go so high. And so then we started going up higher, and then we were up to 360 cc syringes worth.
So you say 360 cc syringes, or
no? First started with 60 cc.
I know, but what was your maximum dose?
The maximum was 160 cc's, 3 of them.
Okay.
And your frequency?
The frequency was, I want to say it was either 24 or 41, and I should have checked I can go back and check my paper where it is, but I haven't on him. I went higher on him, but I would go 24 is what I would probably do. Huh?
How many days in between?
Well, and I can give you the whole chart of that dog, but I initially started out doing it like 3 times a week. We also did UVBI, okay? I also, did rectal ozone and fecal transplants. So all of my cases get rectal ozone and fecal transplants as well. And what we found on this dog, which was so cool, is that here you have a dog that's 14 years old that was going through all this and was very depleted from the bleed out, lost so much blood and was really weak. And we gave the Ozone and a fecal transplant. And she calls me 3 days later and said, and the fecal transplant was from my dog when she was in heat, because she happened to be in heat that week. And the dog was humping the bed at 14 and a half, or almost 15. And I was so excited about it because I thought, this dog, she said, hasn't done this since he's 5. And now he's humping the bed again. How good does he feel that he can start humping the bed and have this cancer in his abdomen? So I just thought that was truly amazing.
Well, and I think
he got mama's microbiome.
Yeah, the microbiome. It is the microbiome. It wasn't the ozone. It was the microbiome.
Yeah.
I also think the most incredible thing about this discussion that you've given us, Margo, is the pain control. And when we think about peritonitis caused by intraperitoneal bleeds and how painful it is, that this is certainly something that we should be thinking about offering. It's obviously a pretty safe procedure. Ozone is a disinfectant. So again, if we can stop that, pain that is concurrent with peritoneal bleeding, with certain types of cancer, with fluid in the abdomen that is irritating. The fact that you talk about treating a TCC, which we all know are very, very painful. And what I know myself from having intravenous ozone, about within 5 to 10 minutes of having that given, I had no pain whatsoever. I think this is one of the most important, humane aspects of ozone therapy that we need to let people know about.
Well, if we want to add to that, I've brought up this case, and I think this to me is the ultimate case, I think, of why ozone works so well. Last May, I had a client that wasn't a client. It was a friend who doesn't use me as a veterinarian, and she was putting her dog to sleep, a 7-year-old Labrador Retriever. And I met her at a voting. I was at the voting, and I said, she said, I'm putting it to sleep. It collapsed 3 days ago, and I can't afford to do any diagnostics. She had taken it 10 days before to a regular vet. They did blood work. Everything was normal, and the dog was getting worse. And it turns out that it was a pyometra, right? So she came in, the dog was moribund. It was hypothermic. It was white. It was laying on the floor. I thought it was dead. And I realized the dog had been unspayed. And I thought, maybe there's this little opportunity that this dog has got a pyometra. So in about 10 minutes, and the owners had no money. So they had no money. So to take it to an emergency clinic and get anything done, it was going to be euthanized right there. And I said, well, let me just cut it and just see what it is, okay? Just in case it is a pyo and I can fix it. This has never happened to me in my career. I opened it up. I did one, and my PowerPoint is on my website. You can see it all. Made a 1-inch incision, and I see pus coming out of the abdomen. So I flushed the abdomen with ozone. I have ozonated saline, so it's running all the time. It's in my surgery suite when we need it. And I took the homeopathics I used was Bellis Paranis and Arnica. And phosphorus for the bleeding, and then sent in my clinic, because I don't use antibiotics at hardly at all standing up, and then I did IP ozone, did intraperitoneal ozone on her, and we had her on all the statistics about how antibiotics have become so resistant in the last 20 years, and it shows you some of the antibiotics that came out, and within a year they were resistant strains. So here we have, they're telling us in this piece for the CE, do not use antibiotics unless you have cultured it out and you know exactly why you're using the antibiotics. And I know from just one day of getting referrals how veterinarians within 5 minutes put them on some kind of antibiotics when they have a cough or when they have a toe infection or what they have. And we are causing the loss of life in the human population, animal population. Right now, 1 million people a year die from resistant strains of antibiotics. 1 million. In the United States, it's almost 35,000 people die. Over 2,500,000 die, are sickened, and billions of dollars are spent to try to save these people's lives. So if you have something that 1 million people in the world die from resistance to antibiotics, and we're willy-nilly throwing antibiotics at kennel cough, or willy-nilly throwing a systemic antibiotic out an ear infection when we have a tool that will take care of it, it really seems really terrible, actually. And my concern is, there are class action suits against doctors that are overprescribing opiates. There very well could be class action suits with veterinarians and farmers and physicians that are overprescribing antibiotics. And so we need to get this tool out to the masses of veterinarians. And I think at this point, with this coronavirus outbreak, I am telling my clients, get an ozone machine today. If you get quarantined in your house or your family's sick and you've got something that will treat viral overload. So get an ozone generator, get oxygen in your house. And so my clients are hopefully doing it, because it's amazing for viral infections and bacterial infections. Anyway, that's, I think, the pyometra story. So when I wrote this all up, submitted it to the Mass Veterinary Medical Association, the AVMA, to Angel Memorial, and their reply was, show us your double placebo-blind studies. And I was like, are you kidding me? A pyometra is a pyometra. I mean, you can watch the video. You can watch the pus come pouring out. I'm not doing double placebo-blind studies. The fact that this dog did not have to have any antibiotics for a long-term or Baytril and doxycycline and all these really fancy antibiotics, and it needed no pain meds. That's, to me, impressive.
That is really neat. One of the questions, there's a few people here. There's some people who are interested a little bit in using ozone therapy at home. It's a good mix of individuals we have. So would one of you be willing to speak just briefly to the idea of ozone therapy at home, what that looks like, and what you recommend or why you recommend that?
Could I go ahead and answer that? I think probably one of the most acceptable ways to use ozone, and I can attest to the fact that it's effective, is an ozone sauna. Those who are not interested in catheterizing themselves or giving themselves IV ozone, or take the time to run ozone through olive oil to get the ozonated terpenes to be able to inhale it, or to eat ozonated olive oil or drink ozonated water, which is rather obnoxious. It is something that we want to do. Ozone saunas are very, very effective. And an ozone generator can be used with a very inexpensive personal sauna, where you can heat with steam, a steam sauna. They are made out of little, you can get one with just a little quilted foil cover that goes over a frame that's made out of PVC pipe, or you can get a more expensive little pod. They are available. I'm not sure whether O3 Vets has such equipment, but again, I think that it's a very good way to go. I personally had Epstein-Barr titers for many years that were somewhat incompatible with life. And I had too big a mortgage to go sit in my room with the windows shuttered and not get up. So I still went to work, but I spent a lot of time with, swollen lymph nodes and all of the signs of Epstein-Barr and chronic fatigue syndrome. I did ozone saunas once a week. I spent about 20 to 30 minutes in an ozone sauna at about 106 was the temperature. I didn't heat up that much because I was chronically cold. But I was treated, and my Epstein-Barr titers went down by over, 3 times. I ended up with pretty even, sometimes even tested negative. And since that time, it was over 10 years ago that I did that. Since that time, I have never had a lymphadenopathy. I have not had but like one aphthous ulcer in my mouth. And I am really grateful for that, because sensitivity to and having Epstein-Barr and chronic fatigue syndrome is the #1 precursor to lymphoma. And all my family dies of lymphoma, so I don't want to go down that road. So I think that's a very good way for people to be a way to treat themselves at home with ozone. I do recommend that you don't do it alone. Any saunaing should not be done alone, because you can lower your blood pressure sufficiently, especially ozone will do that also, that you could faint when getting up. I make sure that when doing ozone saunas that I drink at least a quart of water. during the sauna and make sure that I keep my my fluid balance up. And the saunas are made so that they're little hand holes that you can get your hands out of, and you can put your glass of water somewhere where you can reach it and drink it with a straw. And you put a towel around the neck. No, this is not that you get in the sauna. You get up to your neck in the sauna because you don't want to be breathing ozone. So the towel is around your neck so that it doesn't, get up. And of course, the ozone's a little heavier than air, and will sink to the bottom of the sauna, and we'll fill it up that way. But again, a quality ozone generator can generate sufficient ozone to allow this to happen. And you do absorb it through the skin, and you certainly detox quite a lot. The sweat that comes out will, the oils and such will definitely oxidize quickly. And maybe the towel you're sitting on is going to have some pretty gross looking black stuff where your sweat has drained down to it. But I certainly found this to be a easy enough and comfortable enough way to do it that I think anybody could do this. I think that's certainly a way to treat oneself at home. Otherwise, using ozone at home is useful to have a generator that can either generate ozone from room air, or that can ozonate the oxygen in room air, and you can use it to disinfect spaces. And I've used ozone generators for years in my office. Take the cat out, because the cat doesn't need to be breathing the ozone, but certainly an 8-hour sanitizing treatment in the office can take out all the smells and all of the mold particles and everything else that are in the office. So we certainly use it that way at home. In addition, you can ozonate water, and if you can stand to drink it, more power to you. Ozonate olive oil and use that as wound therapy, and even in eyes. Otherwise, I think that those are ways that we can ethically and safely advise people to use ozone at home. There are a lot of products out there. You can buy ozonated olive oil to use as wound cream, and I put it on horses' legs. You can do it, as an anti-inflammatory. And as I say, I think there are a lot of ways to use ozone comfortably and safely at home.
Great, that's helpful. Marlene, tell us how your patients maybe are using it on their pets at home. How does that typically work?
A majority of our clients are using it rectally. So they find it super easy to take a ozone-resistant catheter. We show them how to place it safely into the rectum. And we make sure they have a different catheter for every member of the family. So they're doing it on themselves, and they're doing it on the pets as well. And they find it to be super easy. And they can make ozonated saline if they want to get a bubbler. But a majority of them in our practice are using it rectally, and they find that to be most effective.
Okay, cool. So obviously with O3 Vets, we have all of the products you will need to do it at home, but the primary focus and emphasis of this today, the Q&A, is going to be centered on veterinary ozone. If you do want to learn more too about how to do ozone therapy at home, get in touch with us. We have a lot of resources for that. So just email me, info@o3vets.com. We can go more over some of that stuff. So we have a couple of individuals in the room who are interested in hearing a little bit about the science behind ozone therapy, and interested in hearing about how it works. Anybody want to take a stab at talking a little bit about that?
I'm comfortable doing that. So ozone is made by nature in the stratosphere. We have lightning that strikes an oxygen molecule, splits it in half, and then when some of those particles come back, they come back as a O3 molecule. And it's a very unstable molecule, but after lightning storms, we used to smell that nice, fresh, clean air. I don't know about anybody else, but I haven't smelled that smell in a long time, even after a thunderstorm. So when we're making it in a machine, we're taking electricity and we're using medical grade oxygen, and we're creating that same scenario where we're taking oxygen, splitting it, and it comes back into a 3 oxygen system. And it has a ton of different effects in the body, but one of the most profound is that it turns on the NRF2 pathways. And there's a lot of information on PubMed. So if somebody really wants to get kind of nitty gritty and down into the nerdy news, that's where they can really get a lot of this information, because there is a ton of information. Also, the Madrid Declaration has a ton of information on how it works. But basically, it turns on NRF2 pathways, which then will turn on over 200 different anti-inflammatory pathways. The other thing it does, it acts as a hormetic stressor. So it actually creates a stress, a short-term stress in the body, which turns on glutathione production. It turns on the mitochondria to make a bunch of antioxidants naturally in the system. You know, we talk about eating a lot of antioxidants, and that's great, but the antioxidants that matter are the internal antioxidants that the body turns on. So turning on glutathione peroxidase and then getting glutathione production is really where the magic happens. So it acts as a hormetic stressor, and of course it increases oxygen saturation. It's antibacterial, antiviral. We know it modulates mood and it modulates pain, because we've already talked about that quite a bit. And there was a couple of other things I wanted to mention besides hormesis was, it increases the NAD ratio. So there's more NAD to NADH. And what that means to us is that it helps to make the Krebs cycle work faster. So we actually make more ATP. And that's a huge issue when we're trying to turn on these healing pathways when an animal is in a healing crisis. To be able to increase the amount of energy that the body is producing is hugely beneficial. So, I mean, it just covered 5 of the most important areas between the NRF2 pathways, helping to modulate inflammation, helping to increase oxygen saturation. Red cell pliability is improved as well, helping to detox the body. All of these are hugely beneficial. So for practitioners, there's almost not a case that walks in the door that wouldn't benefit from having ozone therapy. I think even as a prophylactic to take these animals, we know they're all under stress, especially as animals that are eating species inappropriate diets. I think it would be a wonderful thing to do a rectal ozone as part of an annual visit. And maybe only one time, but you're still stimulating that individual animal to turn on a bunch of anti-inflammatory pathways. Can only mean good things.
Yeah, great. And just to tag onto that, and then Judith, if you want to go deeper into the science and the research, Marlene mentioned a few good resources. The probably the deepest book that I know of is called Ozone, a New Medical Drug, and it was written by Velio Bacci, who did a ton of research on ozone therapy. He's an Italian scientist and researcher, and it's really heavy. It's very deep. So if you want to go deep, that's the best probably book to read that really lets you in on what is happening. And it's not just anecdotal, it's scientific evidence. And then there's some other books that are like the new oxygen prescription, flood your body with oxygen, and some other ones that are out there that are a lot easier to read. A few by Frank Schallenberger that he wrote that are smaller, the ozone applications and methods. So those are available as well if anyone is interested. Dr.
Jonathan?
Shoemaker, yes.
Oh, I'm sorry. If Judith has something to say, absolutely. But what I was going to do was just cover the breadth of opportunity to use ozone in a practice, because a lot of times we veterinarians purchase something and then we don't really utilize it to its maximum ability. And with ozone, I just like to touch on a variety of different ways that we use it in our practice, because it is likely to be one of the most important tools that we have in our practice. So is that okay?
Yeah, absolutely. Hold on one second. Dr. Shoemaker, did you have something you wanted to say on that particular topic?
And yes, I'm back. And this is thanks to Dr. Al, information about ozone as a generator of HSP70, or heat shock protein 70. And heat shock protein 70 is incredibly important. They are intracellular chaperones that help other proteins. They an important role in interaction of proteins and as the folding and assisting of the establishment of, peptide conformation when DNA unfolds and folds back up so that it can keep certain important genes intact. It's one of its ways of treating cancer, is that it not only tells when chaperone proteins tell a cancer cell that's dividing to unfold and refold its DNA, if it is a a DNA strand that can be recovered and make more normal, or if the apoptosis gene can be recovered, that's what HSP70 does. So it will help cancer cells to kill themselves. It will help cancer cells that if they can convert back to being normal, then they will do that. But one of the most important things is heat shock proteins occur in exercise. We produce a small amount of free radical oxygen when we exercise. And they are incredibly important things in response to our biochemistry to any stressors or any damages. And so when these heat shock proteins and the things happen when we exercise, well, that's the same thing that ozone is doing. I always call ozone exercise in a syringe. If I've got a foundered horse that can't walk around, well, I can do the same thing as taking it out and galloping it for 40 minutes. You think that's going to improve its oxygenation and get its metabolism going? It can't even walk, much less run. And so this is a really important thing. HSP70 is the basis of so many functions. Stress proteins, heat shock proteins, they create muscle building. They help joints recover. They allow normal metabolism to recover. And this is one reason why ozone in a sauna can be very helpful. And it certainly is one reason why, as far as unusual ways to use ozone, was using Dr. Al Nunez's technology of sound wave in addition to ozone. And we have had miraculous changes in cancer animals and sickly animals, and my own knee that I screwed up and my swollen ankles, things like that. It's been really pretty remarkable. So yes, HSP70 and then all the terrific things that you talked about. Yes, there's a lot of science behind it.
Good.
Yeah, so you're always, what happens is often you'll get other doctors questioning, well, I've never read anything about ozone therapy. There's nothing written on it. And there's so much has been written on it. I mean, this one book here too, which is Sylvia Menendez, but it's coming reverse on here. I don't know why, but she's got all the double placebo blind studies in here and all the research pieces. And it's really, there's enough now that anytime you have a questioning a colleague that says, I've never heard about it, it's really time to stand up and say, well, you need to start reading about it then, because it's not us. We are providing that information for you. And I had a case, which is, you were talking about different ways of using ozone. I have a lymphoma case from Angel Memorial Hospital, and the dog was diagnosed back in February, a year ago, and started going through chemo and ended up with an infection they couldn't control, and it got into the bone, and it was an osteomyelitis, and they finally isolated nocardia on this dog, and they did multiple surgeries on the dog. They couldn't control it. They had it on 3 or 4 different antibiotics. They couldn't control it. They called me and I said, well, let me get ozone into it. And they said, Angel said, no, the dog's not stable enough. We can't move it. It hasn't eaten. Its leg is so swollen. We can't move the dog. So the day after surgery, I asked the owner just to take the dog out of Angel, leave the catheter in, and let me treat the dog. So the dog came to me. The leg was 3 times its size. It had 2 different drains in it. The dog hadn't eaten for about 2 days or more, and came in, and I injected it with ozone. I knew approximately where the osteomyelitis was on the caudal part of the humerus, but I couldn't get the x-rays. So we went ahead and I just sort of blanketed the area with ozonated gas and underneath. We started at about 24 micrograms and did some Prolo also, into the area, and then did a UVBI, and I used the hemolumen, which is a different type of machine, but I used the hemolumen, and we did a fecal transplant and gave it rectal ozone with some vitamins. The next day, I sent it back to Angel Memorial, and I called this oncologist to tell him what we had done, and she flipped out and she said, there's no studies that have been done on ozone for osteomyelitis. You can't be injecting ozone into the incision. Are you crazy? I said, well, anyway, I gave it a fecal transplant too, and she went, you did what? You gave this septic dog with cancer a fecal transplant? I said, yeah. The next day, I'm not talking about 4 days later, next day, The arm is totally normal size. The swelling all went down, and the dog was eating. And that dog we ended up getting guided ultrasound into the actual osteomyelitis and injected ozone gas directly in. And Angel had said, you have to get this dog's leg amputated. As of now, the dog's been running on that leg for now since August, has been running normally, and Angel retracted that it needed it amputated. Wow. So for osteomyelitis, injecting gas, I was very lucky to get another veterinary clinic that was very experienced as a ultrasound and helped me guide the needle directly into the site of the osteomyelitis. And the dog went out of pain after that. So what are we doing? We've got to use these tools that are so simple. They really are simple tools.
Well, Marlene, I'm going to jump back to you quick to go where you were going to go. And then I'm going to rapid fire some questions that we need to answer really quickly, okay? So go ahead, Marlene, and then we're going to jump into some questions.
So I'm going to start with some of the more common things that we see every day. Diarrhea, definitely one of the things. Let me preface, always do a good workup. Make sure you're doing your diagnostics. Do everything else that you normally do. But we'll do rectal ozone or major autohemotherapy, depending on how sick the animal is, for a diarrhea case. For a vomiting case, the same thing. Wounds, we'll use that as a lavage, usually as a ozonated saline lavage. And then if we have eye injuries, we'll always rinse with ozone. We have a case where we showed an eye ulcer that was healed in about 72 hours using laser and ozone. Intralesional for things like bone cancers or osteomyelitis, doing the PRP where we're injecting ozone into joints for arthritic cases, doing acupuncture into areas like we see a lot, I should say, of degenerative disc disease. A lot of paralyzed dogs come to us and we'll inject ozone along the spine. But some of the easy stuff, ear infections. So we just had a case that had a horrific gram-negative infection along with some yeast. And we had all of the bacteria gone in literally 48 hours. And the dog was more comfortable. And that was just using ozonated saline flush. And then we continued treating for the yeast because it didn't seem to do a lot for the yeast, but it got all the swelling out of the ear and certainly made the animal comfortable and all the bacteria was gone. Other things that we can use it for when you get into some of your more complicated abdominal things. We just took a pyelonephritis case that had an obstructed ureter, huge stone. And when I went in to explore the kidney, pus was just pouring out. So after we took the kidney out, we flushed the abdomen with tons and tons of ozonated saline, same thing. And even though the dog got a little bit of pancreatitis confirmed on lab test, the dog recovered fully in under a week and is back to normal. And she started out with a white count of over 50,000. So we're talking really serious infections, and being able to flood these animals with ozone, whether you're doing it with a saline rinse because we were open in the abdomen at the time, or you're doing it as a gas. We've done the peritoneal lavage with gas as well. Bladder infection. I've got a kitty in right now who's had chronic UTIs. Catheterize them. When they're under anesthesia, we'll empty the bladder out and put gas in there. And usually I don't do gas while they're awake, but he has a catheter in. And we tried it tonight. We actually put in, it was ozonated saline. We put 30 mils back in and just kept rinsing the bladder. And boy, he is so much more comfortable now. Trying to think of dentals. We do a ton of lavaging after we take a teeth out, and we laser, we do ozone rinsing in the mouth. So I can't think of an application that you wouldn't use it. A little cautious when we have a active bleeding hemangiosarcoma, but once we get them stable, we have no problem doing the ozone on those cases.
Great. Okay.
So that was a pretty broad array of things that we see every day.
That was nice and fast. So I'm going to ask rapid fire. We have to answer these quickly and try to get through some of them here in the next few minutes. So first question, any comments on ozone for seizures, frequency, rectal insufflation? To my knowledge, there's no studies. Any comments though?
Well, I think ozone goes through the blood-brain barrier. So oxygen goes through the blood-brain barrier. So anywhere that you can bring more oxygen to the circulation system, and the brain uses more oxygen than anything else. So I always use it for my seizures. I do other things too, a lot of other things, but it's part of it.
So I think it's really important that we always try to get a diagnosis, because we shouldn't be using ozone as a pill for the ill or a tool for it. We want to still get a good diagnosis, and we want to take care of what's causing the problem and then use ozone as a therapy to help heal it. So I'm going to just kind of ground everybody back to, don't forget that just because you have a symptom, you're going to throw ozone on top of it. You still want to go back and find, if you can, what is the underlying reason for that symptom to be there, and then use your ozone as one of your complementary tools to help fix the overall problem while you are stopping doing the thing that caused the problem to begin with, whether that was toxins, whether it was inflammation being produced by leaky gut, whatever that looks like. Always go back to fix the underlying cause.
Great. Okay, Sarah Schaefer asks, what equipment is needed to give ozone at home? So Sarah, write to us and we can help you with that. Basically, it's just an ozone generator and a few accessories to get it into the pet. But write to us and we'll help you out a little bit more. Let's see. What are the effects of ozone besides lowering BP?
Side effects are we talking about? One of the things that when we give intravenous ozone to horses, we notice that there is a drop in blood pressure, drop obviously in heart rate, because of the fact that heart rate's determined by cardiac oxygenation. So we will see horses whose sympathetic balance will move towards the parasympathetic, and we will see increased borborygmi by virtue of the fact that the sympathetic portion of gut movement is propulsive, while the parasympathetic portion of gut movement may be, the contraction that allows propulsion to work. If an animal has gas in its gut and it starts clamping down on it, a horse can have a little bit of a colic type thing. They may end up with a little abdominal pain. It's very transient. All you have to do is interest the animal in something or take it out for a walk, give it a little rescue remedy, and it will be fine. Now, the other thing that you will find in an animal with a lot of infection is you can have an interferon release that can make them feel pretty crummy. They may sweat, because you do get with interferon and also with prostaglandin release from types of things. You may have an animal that sweats. I always, when I'm giving horses intravenous ozone, I always tell the people all the possible side effects. They rarely happen. And if they do, they are very transient. The longest I've had an animal feel uncomfortable from on intravenous ozone, and I'm not talking major autohemotherapy. I'm talking straight ozone IV on a horse, is about 2 or 3 hours. And they just, we just watch them, and we don't give them anything for that. They just need to go for a little walk, and as soon as they'll start eating hay again. I don't think there really are many side effects. The only incidences of side effects in human treatment have been inappropriate applications. The only thing I've ever had happen that was, I have clients who have decided they were going to give their horses intravenous ozone, and 1 or 2 of them have given an intra-arterial injection and severely damaged or killed their horses. So, you don't want to put it intra-arterially. But the incidence of reactions to ozone in German and European studies many years ago were that the incidence of side effects with ozone were 0.000005, which is less than intravenous saline. So I think that the side effects are pretty slim. And other than maybe a little gas pain, that's about it.
What I've seen is they seem to be a little hypoglycemic. Okay. I think the metabolism has sped up from the mitochondrial influx that's been, sort of moving. So I have that's what I see, is them being a little dull. And I'll tell the owner to give them a little bit of coconut water with maple syrup. If they really seem like they're really sort of out of it, they might take a dosage of arsenicum. And that usually snaps them out really quickly.
Great. So Karen Stone asks, can you talk about how to do minor autohemotherapy? Karen, write me and I will send you a video on how to do that tomorrow. Can ozonated oil help someone with lymphoma on the face involving the nose, or would rectal or sauna work better? Any comment on that?
Probably all of those.
All of the above.
I would do
Okay, all the above. So there you go.
And more.
Yeah, and more, yes.
Right.
Margo, did Angel ever acknowledge the benefit from the O3 on that patient you were talking about?
No.
No, okay.
No.
Well,
And
there you go.
I've tried to talk to them, and it's that part of it is very sad. And I think we're going to go back to Al Nunez. I think he saw that too. It was like, you have these opportunities to help your patient, and the owners want it, and the other veterinarians are just sort of not realizing the potential they have of making more inroads with health for their patients. So, but no, they have not acknowledged it, and the dog is doing really, really well. Knock on wood. I mean, it's amazing.
I think
she comes in once every 3 weeks for UVBI, ozone, and a fecal transplant, and is maintained with all her nutritional supplements. And she's actually has Plechner syndrome, so her adrenals and thyroid are weak. So we're supporting those two as well.
I think one of the most important applications we haven't mentioned yet is Lyme disease.
Oh, absolutely.
Absolutely. Yeah. I treat a ton of Lyme disease, and I think one of the only ways that we can treat it effectively in horses after, more than just an acute phase infection where they spike a fever the first time they've been bitten, stuff like that, always treat with ozone if they are, but they may also be getting antibiotics. After that, it's pretty useless to treat with antibiotics. You have to treat with something that will break the biofilm, which ozone does, enzymes and ozone, and then they respond much better to intravenous ozone than anything else. And I know many people that have ended up going to Mexico for both cancer treatment and Lyme treatment, and that was the standard of care there for Lyme disease. Our dear friend Kerry Ridgway was, saved from his Lyme disease by ozone therapy.
So next one question here from Peter. Margo, you know Peter pretty well.
Okay.
He says, have you ever injected ozone directly into or under a tumor or swollen lymph node, and have you seen results? What have you seen for anyone?
Yeah, absolutely. I mean, the first one I ever did was a mast cell tumor in the larynx, and the owner had gone through all the conventional treatments, had one of them removed, but this one was surrounding the larynx. And I injected it with a little sodium bicarb and ozone, and it shrunk down. The owner would keep giving the dog ozone. She bought ozone, an ozonator, and bought saline and was doing it at home. And then all of a sudden it would just start to get bigger. We'd come in and we inject it again. It would shrink down. And this dog lived to about 16 and a half. It was a boxer. And for like 2 years, we just kept doing that to it. And so, and then, my feeling is anytime anyone does a fine needle aspirate, and they do a fine needle aspirate, they should just put ozone, 2 or 3 cc's of ozone there to prevent secondary infections. And I think it's important that that should be part of a protocol to, when you take a fine needle, you put something in there to try to stop the infection, stop the cancer from waking up and traveling around the rest of the body or moving around that area. So that's another, component. And the other part is using ozone for the fecal transplant. And to me, this is where I think ozone is going to be put on the map, because in human medicine, they use vancomycin and metronidazole to disinfect the gut. And meanwhile, you're really taking down a lot of other things by putting them on a systemic medication like that. So by doing the rectal ozone, you're doing 3 things. You're reducing biofilm, which we know it does. We're stimulating the stem cells, which we know mitochondria are highest in stem cells, and they are at the depth of the crypts of the colon. The stem cells are what's developing the columnar cells that are there. And then the ozone goes to the liver through the caudal rectal vein, the caudal mesenteric to the liver. And that is helping detox the liver. So when you do the ozone rectally, you're making a space when you go deep that's sort of blowing away the biofilm and allowing the terrain to be introduced from the donor. So I think that's a really important part, because microbiome restorative therapies and fecal transplants are becoming a very, very common way now that we're treating people and animals.
And, you know, there's something that we've really missed talking about, which I think is extremely important, and that is that this is a technician-driven skill. This is not taking up doctor time, which is a very, very important point to make, because the cost of doing it reduces dramatically. And the fact that the investment in the equipment and even in the training is quite minimal. The learning curve is very minimal when you come down to it. So of all the modalities that we have that are so effective, Ozone is so inexpensive. It's so easy. The learning curve is so low. The cost of administration is minuscule because you got your technicians doing it. And patients can come in as an outpatient. You're monitoring them as the doctor, but you don't have to see each one of them as long as your protocols are being followed. So those are really important points that I think we all need to consider when we're looking at what is the next tool that we add to our toolkit in our practices. I think Ozone is absolutely one of the most important tools to add to that toolkit in today's market.
Great. So I knew this was going to happen, that we would have way more questions than we could handle in the amount of time we had. And I want to apologize to people who asked them and didn't get them answered. I will attempt to answer these via email, some of them tomorrow, as many as we can. I want to throw up something real quick here. So this is something I'm super excited about because it's something I'm heavily involved in.
Fatherhood?
What's that?
Fatherhood.
No. That too, but no, that's not what we're going to talk about. I have 5 kids running around here somewhere. So this is called the Innovative Veterinary Medicine Conference. This summer, we're going to launch a completely online conference. The cool thing, so we're gonna be having lecturers, people from all over the world. We have a panel of individuals who are going to help put together all the lectures and all the speakers and drive that forward. It's going to be focused on veterinary medicine, but for people who are really interested, for their pet parents, and they're really interested in this stuff, you'll definitely benefit as well. The cool thing is it's only going to be $49. So this is a 2-day conference. There's exhibitors. It's all online. Everything it's going to be really cool. It's going to mimic an actual conference. But we're going to do it virtually, and we're going to have people from all over the world, which I'm very excited about. I've said that a couple of times, and it's really inexpensive. So I'm really excited about it.
And you won't get exposed to Corona.
You won't get exposed to Corona.
You can stay home.
And we're going to have some awesome lecturers. We're going to have some really neat events. We're going to make it fun, but we're going to make it hopefully have CE credits as well. So we're working on that. And so I just want to throw this out there. We don't have the schedule set yet, but you can pre-register if you're interested. So I'm hoping that students we have a $29 for a student, for that. And I want to bridge the gap between that and what is traditionally labeled alternative medicine, and bring those together really well. And hopefully, so we have people from academia who are on the panel. We have people from South America, from Asia, or from Europe, and here in the United States, some very respected veterinarians. And hopefully we can do a good job at that. So I want to just alert you to that. We're also going to have another one of these in June. So one of these Q&As where we just open it up. If you ladies are available and want to join us again, we will absolutely have you back to do this. And we'll probably have one other joining us as well, at least. And so I want to, though, thank Dr. Roman, Dr. Shoemaker, and Dr. Siegel for your time. You're very generous with your time. You're very knowledgeable and very helpful for all of the people out there who are interested in ozone therapy. Helpful for me, been a huge support and a blessing to me, and I really want to thank you for that. And look forward to doing more of this later. So final words.
I want to thank you, Jonathan, for having the vision and the energy and the commitment to bringing ozone to the veterinary market, and even just creating the forum that you have. We see that conferences are definitely down in number, and this year they may be canceled totally. So a forward thinker that you are, to bring a medium like a virtual program is absolutely incredibly valuable, and we honor you for that.
Well, thank you.
Well, I'm going to ditto that. I think, in this time where we are trying to encourage both the caretakers and the veterinarians to have an open mind and be able to access information and share ideas. This is a great format for it. And I think having it maybe, having different levels, or I think opening it up to both the lay and the consumer, and the veterinarian rather, would be a great format that people can participate and get what they can. And, as long as people feel very secure with, I want people to be able to have a veterinarian that they can rely on to help them, just not start doing this stuff without some kind of coaching that they can be supported. But I really appreciate you spending time, Jonathan, trying to encourage the veterinary profession to really understand ozone as an accessible modality that they can use.
And thank you, Jonathan, for doing it in a way that empowers people. It is not, it's not easy to promote something like this. People don't do anything they don't feel like doing. And so you personally and professionally have done a really good job of empowering veterinarians to be able to spread this, and empowering people to ask the questions about it, empowering the public to be knowledgeable enough. And I really, really appreciate that. I think this is going to go where we want it to go because of the kind of effort that you've made. And I sincerely hope that we can do this for a lot of different modalities, but you're really making a mark in the marketplace, and you're making an effort that I think we all could emulate, and you're doing a wonderful job. Thank you so much.
Oh, well, that's very kind of all of you, too kind. So thank you for your time. That's it for this evening. Again, thank you for everybody for joining. There's a lot of comments. There's a lot of people saying thank you to you three. One who said you're rock stars. So yeah, great. Again, have a great night, everybody. We will see you soon.
Thank you all. Bye.
Thank you.